Hey, did you realize you can actually be enrolled into a Medicare Advantage plan and also have a federal employment health benefit or FHEB? In this video, I'm going to cover exactly how the two can work together and provide you additional benefits and coverage that original Medicare doesn't provide, that the Medicare Advantage plan can provide, and ensure you, if you do that, how they coordinate, how you can utilize the benefits, and see if that's a great fit for you. Stick around, we're going to cover this in today's video. Hey, today we're tackling a crucial topic for retired federal employees. How does Medicare Advantage plans and FEHB plans work together? We're going to cover every step, answer common questions, and give you a real example so you feel confident about your healthcare choices. So yes, you can enroll in a Medicare Advantage plan while keeping your FEHB coverage. You'll have dual coverage, giving you a mixed benefits for both plans. Medicare Advantage plans will be your primary insurance, and your FEHB will step in as your secondary. But just because you keep both doesn't mean it's the right choice for everyone. In this video, we'll help you understand if dual coverage is right for you and break down exactly how it works so you never get a surprise at the doctor's visit or a hospitalization stay. All right, so let's walk through an example to see how Medicare Advantage and FEHB plans coordinate. I'll take you through what happens when you hand both cards to your doctor so you can understand how each plan pays and how you're really protected. Many people worry about handling two types of coverage. What if they slip through the cracks and I'm left with a surprise bill? That's really a concern that a lot of people ask us. Here's an example to make this clear. Let's say you're a retired federal employee named Jane who has a Medicare Advantage plan and kept her FEHB. Jane needs to see her doctor for a routine checkup, so she hands over both of her Medicare Advantage card and her FEHB card at the doctor's office. So here's what happens next. Jane's doctor will bill her Medicare Advantage plan for the visit. Medicare Advantage, acting as her primary insurance, processes the claim and pays its portion for the Medicare covered service like Part A and Part B would do. After the Medicare Advantage processes the claim, there's usually a remaining balance with like a copay, coinsurance, or deductible. The provider sends this remaining balance directly to Jane's FEHB plan. The federal employment plan acts as a secondary payer, so it picks up some or all of the leftover costs based on the specific terms of her plan coverage. Here's where FHB can be really helpful. Depending on her plan, Jane may end up paying zero out-of-pocket costs because her federal employment plan covers the remaining balance after the Medicare Advantage plan pays. So, out-of-pocket maximums. Medicare Advantage plans have an annual out-of-pocket maximum which limits what you have to spend. So FEHB may help you reach that limit even faster, providing more financial protection. Since original Medicare doesn't have a max out-of-pocket, and the Medicare Advantage plan does, you can often save depending on the benefits of the federal employment plan that you choose. Some people find that the combined cost of Medicare Advantage plus your federal employment plan can actually save them money, especially with high option plans for federal employment retirees. Now, on a common question we get is about prescription drug coverage. If your FEHB plan has a great drug plan, do you still need a Medicare Advantage plan with a drug benefit? Many people worry about duplicating coverage or paying for benefits they don't actually need. The great news is you have options here. If you're happy with your FEHB prescription drug coverage, you don't have to enroll in a Medicare Advantage plan with a drug coverage option. That's known as a Medicare Advantage prescription drug plan. Instead, you can go with a Medicare Advantage only that doesn't include the drug plans, also called a MA only plan or Medicare Advantage only plan. These plans often have a Part B buyback benefit that can pay down a portion or a large portion of your Part B premium that Medicare charges. Anyone with Medicare Part B understands what this cost is. So if you don't need the additional coverage for drugs, I would suggest looking at the plan options in your area that cover your access to care and additional benefits such as the Part B buyback. So let's look at a snapshot of the plan options you really have to choose from for Medicare Advantage. So one is going to be a MAPD or Medicare Advantage prescription drug plan. These include the Part D drug coverage so they can handle your medical and prescription needs in one plan. This might be a good fit if you like the idea of an all-in-one plan. The other option is a MA only plan. These plans only cover medical services and hospital, and if your FEHB plan already covers robust drug coverage, this could be a way to avoid paying extra for drug benefits you don't really need, or honestly you just don't need it and it has a Part B buyback and is a better option for you enrolling into the MA plan with no drug benefit, because you're going to use your federal retirement plan for the drug benefit. Or if you're like, hey, I want the best of both worlds, some people will roll into a Medicare Advantage prescription drug plan that has a drug benefit, and they can work along the FEHB, and sometimes you can use your Medicare Advantage plan to get a refill filled with certain medications, and then your retirement federal plan for other medications. You can use both, or you can do, as I said, the MA only, which a lot of times in our markets have a Part B buy down. So if Jane's federal employment plan has great drug benefits, she may go for an MA plan only, giving her dual coverage without any duplication or extra cost for prescription coverage. This is really all about building a plan, again, around your unique needs. You need to ensure you're working with a licensed professional that can give you the guidance you need when you're doing this. My encouragement is to take a moment now, schedule a time with us, let us guide you through this process. One of our licensed professionals are experienced at coordinating plans with federal retirees and those on TRICARE as well. Keeping both Medicare Advantage and FEHB sounds great, but what's the real benefit? Let's break down the pros of what we call dual coverage. Many people aren't sure if they're paying for both is worth it, or paying for both is worth it, especially when healthcare costs are already high. Here's why dual coverage can be a game changer for federal retirees. Your financial protection with a Medicare Advantage plan has out-of-pocket caps, which FEHB can help reach more quickly, lowering your costs. That's a main reason. Network flexibility. Medicare Advantage plans have network restrictions, but FEHB offers broad access. Together you get more flexibility on your providers altogether. And then really the additional benefits or perks, from fitness programs to dental and hearing and vision. Medicare Advantage plans can offer extra perks that enhance the federal employment health benefit coverage. So with dual coverage, you're really maximizing both plans' strengths. You're combining two, but you're going to maximize both plans' strengths, which is beneficial for you if you understand how the plan works. What if you're not sure you want both plans permanently? You can choose to disenroll from your FEHB plan if needed, and here's why. Sometimes people are worried about getting stuck with a dual coverage if it ends up not working out. Here's the great thing. You don't have to permanently drop your FEHB to try Medicare Advantage. You can choose to suspend your FEHB instead. If you find Medicare Advantage plans alone isn't enough, you can re-enroll in your FEHB during your open season or qualifying life event. This is a unique benefit that gives federal retirees flexibility and peace of mind. Most retirements are called involuntary plans. Once you disenroll, you lose the option to ever enroll again. FEHB is called voluntary enrollment, which means you can typically drop the coverage and pick it back up in the future. You've earned the coverage and you can go back into FEHB plans or plan options anytime in the future during the enrollment season for that plan. You're not stuck without options. So dual coverage with Medicare Advantage and federal retirement benefits can be incredibly beneficial if it's the right fit really for you. You get the benefit of both plans working together to maximize your protection, minimize your out-of-pocket cost. If you have questions though, and you want help navigating your options, reach out directly. We're here to be able to make your life easy by making Medicare simple. Click below, schedule a time. We'd love to talk. Hey, thanks for watching, and don't forget to check out our free resources like the Medicare Made Simple workshop and the step-by-step guide to signing up for Medicare. The links are in the description below. And guys, make sure to subscribe so you don't miss out on future videos, and also share with friends and family that may be confused about Medicare. We'd love to be able to help you, and we'll talk to you in the future.